Health Tips for Improved Health 2023. The first quarter of a new year brings with it new resolutions to improve one's life, including a healthier lifestyle. Here are practical health tips to help you start off towards healthy living in 2023. Eat a healthy diet. Eat a combination of different foods, including fruit, vegetables, legumes, nuts and whole grains. You can improve your intake of fruits and vegetables by always including veggies in your meal. Eating fresh fruit and vegetables as snacks. Eating a variety of fruits and vegetables, and eating them in season. By eating healthy, you will reduce your risk of malnutrition and non-communicable diseases such as diabetes, heart disease, stroke and cancer. Consume less salt and sugar. Some people consume twice the recommended amount of sodium, putting them at risk of high blood pressure, which in turn increases the risk of heart disease and stroke. Most people get their sodium through salt. Reduce your salt intake to 5 grams per day, equivalent to about 1 teaspoon. On the other hand, consuming excessive amounts of sugars increases the risk of tooth decay and unhealthy weight gain. In both adults and children, the intake of free sugars should be reduced to less than 10% of total energy intake. This is equivalent to 50 grams or about 12 teaspoons for an adult. Reduce intake of harmful fats. Fats consumed should be less than 30% of your total energy intake. This will help prevent unhealthy weight gain and NCDs. There are different types of fats, but unsaturated fats are preferable over saturated fats and trans fats. WHO recommends reducing saturated fats to less than 10% of total energy intake, reducing trans fats to less than 1% of total energy intake, and replacing both saturated fats and trans fats to unsaturated fats. The preferable unsaturated fats are found in fish, avocado and nuts, and in sunflower, soybean, canola and olive oils. Saturated fats are found in fatty meat, butter, palm and coconut oil, cream, cheese, ghee and lard. And trans fats are found in baked and fried foods, and pre-packaged snacks and foods, such as frozen pizza, cookies, biscuits, and cooking oils and spreads. Avoid harmful use of alcohol. Consuming alcohol can lead to health problems such as mental and behavioral disorders, including alcohol dependence, some cancers and heart diseases, as well as injuries resulting from violence and road clashes and collisions. Don't smoke. Smoking tobacco causes lung disease, heart disease and stroke. Tobacco kills not only the direct smokers but even non-smokers through secondhand exposure. If you are currently a smoker, it's not too late to quit. Once you do, you will experience immediate and long-term health benefits. If you are not a smoker, that's great. Do not start smoking and fight for your right to breathe tobacco smoke-free air. Be active. Physical activity is defined as any bodily movement produced by skeletal muscles that requires energy expenditure. This includes exercise and activities undertaken while working, playing, carrying out household chores, traveling, and engaging in recreational pursuits. The amount of physical activity you need depends on your age group, but adults aged 18 to 64 years should do at least 150 minutes of moderate intensity physical activity throughout the week. Check your blood pressure regularly. Hypertension, or high blood pressure, is called a silent killer. This is because many people who have hypertension may not be aware of the problem as it may not have any symptoms. If left uncontrolled, hypertension can lead to heart, brain, kidney and other diseases. Have your blood pressure checked regularly by a health worker so you know your numbers. Get tested. Getting yourself tested is an important step in knowing your health status, especially when it comes to HIV, hepatitis B, sexually transmitted infections, STIs, and tuberculosis, TB. Left untreated, these diseases can lead to serious complications and even death. Knowing your status means you will know how to either continue preventing these diseases or, if you find out that you're positive, get the care and treatment that you need. Get vaccinated. Vaccination is one of the most effective ways to prevent diseases. Vaccines work with your body's natural defenses to build protection against diseases like cervical cancer, cholera, diphtheria, hepatitis B, influenza, measles, mumps, pneumonia, polio, rabies, rubella, tetanus, typhoid, and yellow fever. Practice safe sex with your married spouse. Looking after your sexual health is important for your overall health and well-being. Practice safe sex to prevent HIV and other sexually transmitted infections like gonorrhea and syphilis. Cover your mouth when coughing or sneezing. Diseases such as influenza, pneumonia and tuberculosis are transmitted through the air. When an infected person coughs or sneezes, infectious agents may be passed on to others through airborne droplets. Prevent mosquito bites. Mosquitoes are one of the deadliest animals in the world. Diseases like malaria and lymphatic filariasis are transmitted by mosquitoes and continue to affect people around the world. You can take simple measures to protect yourself and your loved ones against mosquito-borne diseases. Wear light-colored, long-sleeved shirts and pants and use insect repellent. At home, use window and door screens, use bed nets and clean your surroundings weekly to destroy mosquito breeding sites. Follow traffic laws. Road crashes claim over 1 million lives around the world and millions more are injured. Road traffic injuries are preventable through a variety of measures implemented by the government, such as strong legislation and enforcement, safer infrastructure and vehicle standards, and improved post-crash care. You yourself can also prevent road crashes by ensuring that you follow traffic laws, such as using the seatbelt for adults and child restraint for your kids, wearing a helmet when riding a motorcycle or bicycle, not drinking and driving, and not using your mobile phone while driving. Drink only safe water. Drinking unsafe water can lead to waterborne diseases such as cholera, diarrhea, hepatitis A, typhoid and polio. Globally, at least 2 billion people use a drinking water source contaminated with feces. Check with your water concessionaire and water refilling station to ensure that the water you're drinking is safe. In a setting where you are unsure of your water source, boil your water for at least 1 minute. This will destroy harmful organisms in the water. Let it cool naturally before drinking.